Hello everybody, my name is CJ and today I'll be presenting a tutorial on how to increase dorsiflexion. Now dorsiflexion is the motion you do with your foot when you bring your toes up to either step on something or when you go down on your foot and you bend and take your next step. I'll be showing you how to passively do it, how a physical therapist would do it in the clinic if you lack the range of motion to help you dorsiflex, and which muscles are associated with that motion. So let's go and learn. Some things that you want to consider when working with a patient or client is to always be on the same side or body part that you're working on. But for the purpose of this video, I will be on the opposite limb so you're able to see the motions that I am demonstrating. Being on the same side gives you a better leverage for your body mechanics and may make the patient more comfortable that you're not reaching over them. And finally, always make sure your patient is comfortable in their environment before you begin any treatment. So as I mentioned previously, you want to be on the same side of the limb that you're working on. But for the purpose of this video, so you guys can see, I'll be on the opposite limb. The purpose of the towel is to slightly elevate the limb so it's not restricting any motion. So the first thing we'll be talking about is the difference between plantar flexion and dorsiflexion. Plantar flexion is the motion that you do when you push down on the gas pedal, and dorsiflexion is the motion you do when you release your foot off the gas pedal, which is a motion we'll be increasing today. According to the Journal of Bodywork and Movement Therapy, there are 3 primary muscles associated with the movement of dorsiflexion. The first one we'll be looking at is the gastrocnemius. The gastrocnemius is a 2-joint muscle that crosses both the knee and the ankle joints, which is why the position of your knee may affect the amount of dorsiflexion you get, especially if you tight back there. The next muscle is the soleus, which allows for greater ankle dorsiflexion when the knee is flexed because you take out the gastroc and isolate strictly the soleus muscle. As you can see, you get less dorsiflexion when the leg is straight as opposed to when it is bent, you get more dorsiflexion. Finally, you have the tibialis anterior on the top of the leg, which is the muscle that initiates the movement. Now we'll move on to the joint mobilization that we'll be using today, called the Maitland technique. This technique consists of 5 grades. Grade 1 and 2 is for pain, 3 is for maintaining the motion, 4 is for increasing the motion, and 5 is a thrusting technique that not many therapists are trained to do. Remember, before you begin anything, you want to position your body in the most comfortable way to allow yourself to use proper body mechanics to reduce the risk of an injury, which is why I'm lowering the bed so I can keep my elbows straight as I push down to do the posterior glide to increase dorsiflexion. The points of contact when applying this posterior glide is to have the cranium of your hand on the tibia and the other hand over the talus just distal to the mortise to maintain the ankle in its resting position. You also want to have the foot hanging over the table and make sure you're standing on the side of the patient's foot and not directly in front of them. Here I am demonstrating a grade 3 mode that consists of a large amplitude with rhythmic oscillations that perform up to the limit of available motion and stressing the tissue resistance. This mode should be done for 2 to 3 seconds for 1 to 3 minutes. Remember, with the convex on concave rule, the roll and glide go in opposite directions, which is why I'm holding the foot in a slightly dorsiflex position and pushing it down posteriorly. This grade is a grade 4, which consists of a small amplitude of rhythmic oscillations that are performed at the limit of available motion and stress into the resistance of the tissue. The oscillations are usually rapid as displayed in this video. So now we're going to move on to passive range of motion. When doing passive range of motion, you want to position yourself in a safe and comfortable manner, as well as making sure the patient is comfortable. And you want to grab one at the calcaneus and place the other hand right over the tibia to fixate the leg onto the table. You just want to rock back and forth, and remember, it is passive range of motion, so you're not holding it as a stretch. You're just moving the foot up and down in the motion that the ankle joint does. When standing in this position, you want to have your feet staggered and slightly wider than shoulder width apart so you can fluidly rock back and forth as you move the ankle joint in its range of motion. Let's now move on to the physical therapist stretching the patient. So when you're stretching the patient, you want to grab at the calcaneus and have the forefoot at your distal forearm and lean forward while keeping your arms straight. and the patient's foot in that position for a minimum of 15 and a maximum of 60 seconds. And don't forget to stabilize at this tibia. Now I'm going to have the patient stretch the joint themselves. According to the International Journal of Sports Physical Therapy, the American College of Sports Medicine recommends that each static stretch should be held for 15 to 30 seconds and repeated 2 to 4 times. Something to remember, when you send the patient home with passive/static stretches like in this video, they can use a belt, towel, shirt, or any safe and comfortable object that allows them to hold this position for a minimum of 15 seconds and a maximum of 60 seconds. And finally, we'll move on to the strengthening part. Before sending the patient home with strengthening exercises, you want to show them how to properly position themselves and the equipment that they may be using to help strengthen that muscle. This exercise that I am helping the patient with is to help strengthen the tibialis anterior. You want to wrap the resistant bands around the foot twice to reduce the risk of it coming off the foot. Before placing it on the foot, you want to anchor it, the other end of the band, on a piece of furniture or equipment that is heavy enough to resist the pull that the patient may be placing on the band. Thank you guys for watching, and I hope you guys liked it.